Everybody's heard about breast cancer. Almost every week in magazines or sponsored events, breast cancer gets a tremendous amount of publicity, and with good reason. About 48,000 women a year are diagnosed with breast cancer, and 12,000 of them, that's a quarter of them, die from it. But what's less well known is there is a disease confined to men, a cancer confined to men. 40,000 men get this every year, and again, a quarter of them die from it. During the last 3 years, 6 acquaintances of mine have been diagnosed with cancer of this organ. 2 of them have since died, unfortunately. The other 4 went to the doctors at the first signs that there was a problem, and they have been treated for it, and so far so good. So the earlier you solve this problem, the better. Now, some cancers of this organ are so slow growing that you die of old age before it ever becomes a problem, or die from some other condition. But in some people this cancer is quite vigorous, and it'll see you off. So this little video is about this organ, the prostate gland, which plays a part in reproduction. For the purpose of this video, it's not really important to know what part it plays, or to know the names of all the various bits. This is quite simply raising your awareness because of my experiences, and when I talk to other blokes about it, it's amazing just how ignorant they are about this matter. You should recognise this quick sketch as your male reproductive organs, your male bits. This of course is a penis, these are the testes, and this is your bladder. And this is your anus and your rectum. These two tubes lead up to the kidneys, so your urine comes down there and it's stored in the bladder. And at the bottom of your bladder you've got a little valve to stop it leaking out. So when you open this little valve, the urine runs down there, down this tube and out. And these things make sperm, of course, and the sperm travels up here. And then marked in red, round this little T-piece here, is this organ, the prostate gland. And this little video is about this thing here. This is just a little bit of information for you young blokes out there. What you've got coming to you. As part of the male reproductive apparatus, we have this thing called the prostate gland. It's about the size of a walnut when you're younger, but as you get older it gets bigger and bigger and bigger till it ends up about the size of a mandarin. Mandarin is a bloody mandolin, about the size of an orange. And it's wrapped around your pipework. And as you get older, of course, it squeezes the pipework, which means that it becomes much more difficult to go for a pee. To the extent where it takes so long that, particularly at night, but by the time you get back to your bed and climb in, you have to climb out again and go again. If you live in a big house, it's even worse, because you don't get back to your bed, you just get halfway along the landing and you have to go back. And there comes a time, and this of course it gets worse and worse and worse, but until you reach the stage where it sort of coincided with your brain becoming addled at the same time. As your brain's becoming addled, you have this sort of set of instructions in your brain where it's sort of undo your flies, pull out your todger and pee in that order, or sort of 3 instructions. And of course, as your brain becomes addled, you know what the 3 instructions are. But in the words of Eric Morecambe, you don't necessarily know the right order, which can be a bit of a disaster. And then, of course, spending days on end trying to make sure you have everything in the right order, some beggar comes along with a 4th instruction, which is stand up. And that just adds to the complication. Anyway, that's what you've got to look forward to. And then before you know where you are, this blooming thing, this prostate gland, it becomes cancerous. It's a major killer of men. And so it pays to have it checked when your waterworks aren't quite as free-flowing as they once were. You know, when you're standing in the pub and dribbling away, and some young fella comes in and one loads about 3 times as much as you have in a matter of a minute, and then disappears, and then comes back later and sees you still standing there. It's time to get this thing checked. And too many men don't do it. Too many men just put this off, you know. It's not the macho thing to do, hard as nails, you know. It's absolute madness. And there's a physical inspection, which is not particularly pleasant. It involves somebody's finger and your backside, but you have to go with it. And also there's a hormone which travels around in the blood. It's called a prostate specific antigen, which is actually a chemical. And if your prostate gland is in good nick, then the level of this is called a PSA, and the level of this is quite low. And if the level begins to climb rapidly, then there's obviously something seriously wrong. And there are various options you can have done. Whether you want the whole thing completely removing, or whether you want it zapped with some kind of radiation or whatever. But don't delay. Don't put it off. Otherwise, it's a death sentence. And obviously, when you're having this kind of treatment, there are side effects to it, whether it's impotence or incontinence. Make sure you know the difference. There's a funny little story of someone who'd been to the doctor, and when he came out, they asked him how he was, and he said he was very well. The doctor had told him he was important. If you catch this thing early enough, then there are lots of treatments for dealing with it, most of which are very successful, and a large number of people just get on with their lives. After a lifetime of paying into some pension fund, which you're only going to get when you're 60 or 65, or it's probably even older as years go on, and you want to live as long as possible to get as much of that money back as you've paid in. Otherwise they'll only squander it on some harebrained scheme like windmills or banning conkers. So if for no other reason than that, if you have any symptoms, then go and see your doctor and get yourself checked out. But that's what you're in for. Tight lines.